take these two.
Okay, Dr. Johnson, I got a question from Mr. Murray over the weekend about, and it kind of gets off of the subject that Dr. Kelly talked about, but could you comment from the public health perspective on this Delta variant for COVID that, at least he and others have questions about?
Absolutely. So one of the things that we know and have spoken about throughout the year is just that public health preventive measures, right? And so we have right now in our toolbox the most powerful preventive measure, which is our vaccine, and that is still available. I think the important thing about this COVID virus is that we recognize that when it has a chance to infect people, it has a chance to evolve and find a better niche, right? And that's how we've been coming up with these variants. And the variants tend to look for ways to be more transmissible. And then we've been tracking to see if there is increased severity. And there are the variants of concern. And Delta is the most recent one that has popped up. It came originally out of India and now is in America, and we see it here in El Paso County. It is more transmissible. We are still really understanding the severity rates and fatality related to that. What is really important to understand is that it is still, the vaccines that we have are still efficacious against the Delta variant. And so knowing that it's more transmissible, we need to, particularly if you are unvaccinated, you need to still take the precautions. We know that we still have this, we talked about going from pandemic to endemic, means the virus was new and evolving through our communities. It is now in that endemic phase. We have numbers that are smoldering in the background. The virus is still here. We still see that there are cases and hospitalizations related to that. So if you're choosing not to get vaccinated, you really still need to practice those layered preventive measures that we talked about. And it is not mandated any longer, but keeping your social distance, really being careful about numbers and locations that you are engaging, and wearing a mask, good hand washing. Outdoors is always better than in, right? These are the things that should just kind of be a mantra. But in lieu of that, our best measure is still that vaccine. And so if you have the opportunity to get vaccinated, it is widely available, it is disseminating now from our more mass vaccines into just being with your primary care provider. You can go to elpasocountyhealth.org and look underneath our little vaccine tab and see how you can connect yourself to a vaccine and join in protecting yourself, protecting your neighbor from being able to transmit it, and then ultimately protecting our community for the impact that we want, which is to interact back to as normal as possible.
Yep. Thanks, Dr. Johnson. Any
Absolutely.
questions for her about that? Yeah, go ahead, Richard.
Yeah, Dr. Johnson, so, the big question for a lot of the people in my world is that the people who are vaccinated, can they still give the Delta virus to somebody who isn't or is extra vulnerable? So, we have, people with chronic diseases, are working in our complex. We, have a few people that aren't vaccinated, and that seems to be the real confusing question. I see you're not wearing a mask right now, and nobody is from the health department, and yet you hear about Los Angeles recommending masks because of the Delta variant and the World Health Organization. And I wonder what your advice was. It's a tough one for those of us who are vaccinated that want to be out in the world, but we also wouldn't want to, bring it back to somebody that is vulnerable.
Absolutely, and I think that is some of why healthcare still has an art to it because some of these things are fairly nuanced. And so when we talk about the efficacy of a vaccine, when you're vaccinated, it's not like 100% that you're not going to contract the infection. It depends on how many people around you are vaccinated. And so you hear that term herd immunity because you're breaking the chain of transmission. It depends on how good your own immune response was to that. And so for some people who may be on some of the biologics, let's say for an autoimmune disease or something, their immune response may be muted. And so even though we would want them to get vaccinated and their primary care would ask them to be vaccinated, they still may be wearing a mask because that is, again, is that layered approach of preventive health. And so when we talk about being vaccinated, and I am vaccinated, which is why I've taken my mask off, but I certainly carry a mask with me so that if I know I'm in a situation where people are unvaccinated or they have concerns and would like me to wear a mask, I can respectfully put that right back on. Because again, it's a preventive measure. I think as far as contracting the infection, there still is a small chance of being able to contract the infection. The severity of disease in those who are vaccinated is significantly less than if you are unvaccinated. And we are following that with Delta, again, gathering data around that severity and potential fatality. But we haven't, the other thing is when you contract it, if you've been vaccinated, your viral load is significantly less. So the ability for you to actually transmit it drops significantly. And so part of what we talk about when you get an infection is inoculation. And so how much virus are you exposed to? It's very different if your body sees one little virus particle versus 100 versus 1,000, which again is why we talked about limiting group size, right? If you're exposed to over a day, one person who's sick versus 100 people who are sick, your likelihood and probability of actually contracting the infection is very different.
Okay, and then one more question, if I can.
Go ahead, Richard.
So how are we doing here with vaccinations? And let me qualify this question a little bit. I know that we have a little bit low. We have a lower rate than the rest of the state. We also have a lot of tourists here from states that may not have a high vaccination rate. And we also don't know. I don't know if we're really tracking the military as part of these numbers. I know you certainly track, through all the health providers and everything else. But I just wonder if you could give me a little summary of how we are doing and where we need to go.
So I haven't looked at those numbers today, but we have a data dashboard on the El Paso County Health.org, and they are following the vaccination rates. So you can look at those, and those are updated, I want to say at least weekly. The vaccination rate in El Paso County is over 50% fully vaccinated. So that's 2 doses. And what we do know, particularly with the Delta variant, is that you want to get that second dose. It's going to be really important. And we have a high rate of people completing their vaccine series, which is really, I think, one of the strongholds of El Paso County is that people get that second dose, because that truly is the key to success is getting the complete series. We do have a data agreement with our federal partners here in the county. It has been a challenge, I think, across the nation to actually get those numbers because their jurisdiction is different. If you're vaccinated through the county, it's entered in the Colorado Immunization System, SIS, and we can pull those numbers. If you're vaccinated through the federal, it's a different documentation system, and those numbers are not necessarily shared easily, but we have figured out a way to do that through our data and analytics office. And we are over 60% vaccinated when we include those federal numbers. And so it is a slow tick upward, but we are making progress. And again, it is really about having the opportunity to engage with people, talk about where they are in their own sense of why or why not to get vaccinated, answering questions, alleviating fears, and then hopefully changing the paradigm into that this is the norm, that we just do get vaccinated because it's preventive, it protects me, protects our families, and it protects our community.
Thank you. We had several other questions, but I've got a community member who texted this to me and wanted me to ask, is there any plan for the El Paso County Public Health to have volunteers go door to door to check on vaccination status?
I'm not aware that there's a plan to do that, and but certainly we are open to new and innovative ideas and reaching out to people wherever they are to hopefully, just meet them with an opportunity to learn and step into the next phase.
Okay, we'll go to Randy and then Nancy.
First, thank you, Dr. Johnson, for everything you and your organization is doing, the office is doing. I saw that on Saturday when we had the Olympic and Paralympic Day in Deerfield Park. The mobile vaccination unit was there. And after talking to them, I didn't think anybody would come up, but they did. They said they had several people come up and get their first vaccination. And so I think it's so important that we're out there in every way possible. And I just wanted to thank you for that.
Thank you.
Nancy?
Yeah, what's the age, how low now can you go in age for inoculation?
How low can you go? Sounds like we're going to do the Mamba. 16. There is ongoing research being done, and we're hoping that we'll be, dropping that age as we enter into the school year, but more information to come.
I forgot to, Richard asked a question about the military here. Yep. I can't speak for Fort Carson or Schriever or Peterson, but I can speak for the Air Force Academy. Being involved in that up there, as of late spring, the cadets, the over 4,000 cadets, more than 90% had been vaccinated in late spring, and that's probably even grown through the summer. So just to answer Richard's question.
All right.
Thank you.
With the presentation.